5.21 million infected,
2.05 million recoveries,
338,000 deaths.
COVID-19.
What is COVID-19?
How to protect yourself
And keep everyone around you safe too. The coronavirus disease, COVID-19, is an infectious disease caused by a new strain of coronavirus.
This new virus and disease were unknown before the outbreak began in Wuhan, China in December 2019.
World Health Organization has characterized COVID-19 as a pandemic due to the exponential increase of the number of cases in more than 100 countries.
The disease has hit certain countries including Italy, Spain, the UK, and the US with particular cruelty. The COVID-19 is an infectious disease caused by severe acute respiratory syndrome coronavirus 2 SARS-CoV-2.
COVID-19 is known to target a person's respiratory system. Signs and symptoms:
Cough,
shortness of breath,
fever,
chills,
muscle pain,
sore throat,
diarrhea,
vomiting. Serious symptoms include
trouble breathing,
persistent pain or pressure in the chest,
bluish lips or face,
inability to wake or stay awake. Points to remember: 1. On average, it takes 5 to 6 days from when someone is infected with the virus for the symptoms to show. However, it can take up to 14 days.
2. Infected patients may also be asymptomatic.
3. Seek immediate medical attention if you have serious symptoms. Always call before visiting your doctor or health facility.
People with mild symptoms who are otherwise healthy should manage their symptoms at home. COVID-19 prevention.
Protect yourself and others around you by knowing the facts and taking appropriate precautions. Follow advice provided by your local public health agency.
To prevent the spread of COVID-19,
clean your hands often. Use soap and water or an alcohol-based hand rub.
Maintain a safe distance from anyone who is coughing or sneezing.
Don't touch your eyes, nose, or mouth. Cover your nose and mouth with your bent elbow or a tissue when you cough or sneeze. Follow the directions of your local health authority. Stay home if you feel unwell. Avoiding unneeded visits to medical facilities allow healthcare systems to operate more effectively, therefore protecting you and others. If you have a fever, cough, and difficulty breathing, seek medical attention. Call in advance. COVID-19 treatments. To date, there are no specific vaccines or medicines for COVID-19. Treatments are under investigation and will be tested through clinical trials. A majority of people, about 80%, who develop COVID-19 symptoms do not require hospital treatment. People who think they might have COVID-19 can consider the following tips. Number 1. Tracking symptoms and keeping in contact with healthcare providers. 2. Staying home unless seeking medical care. 3. Wearing a face mask or cloth covering over the nose and mouth when other people are around. 4. Self-isolating from other members of the household until symptoms resolve. People can also consider the following at-home treatments for any COVID-19 symptoms they develop. Try cough syrup or throat lozenges for persistent coughing. Taking an over-the-counter pain reliever. Drinking warm liquid to relieve a sore throat. Drinking plenty of water to stay hydrated. The CDC recommends that people with COVID-19 symptoms can end their home isolation if at least 10 days have passed since symptoms first appeared and received a positive COVID-19 test. They have not had a fever for 3 consecutive days without using fever-reducing medications. They can breathe easily and notice improvements in respiratory symptoms. Most people develop mild or moderate symptoms of COVID-19. However, some individuals experience severe respiratory symptoms including severe fatigue, difficulty in breathing, persistent pain or pressure in the chest, and bluish lips or face. People who experience one or more of these symptoms should seek immediate medical care. A doctor may treat a person with severe COVID-19 symptoms with one or more of the following: Mechanical ventilation. This involves inserting a tube into the person's lung through their nose or mouth. Intravenous treatment. This can treat and prevent dehydration and restore electrolytes to the body. Sedative treatment. This can include antipsychotic or anti-anxiety medications. In summary, currently there are no approved drugs or vaccine available for treating and preventing SARS-CoV-2 infections. People can prevent the spread of SARS-CoV-2 by practicing protective measures such as physical distancing in public spaces and self-quarantine when sick. Severe symptoms may require intensive medical intervention and hospitalization.